Okay, so ready to dive in.
Yeah, let's do it.
All right, so today we're tackling something, uh, a little different,
Mhm.
something you might not have heard of before, but
Yeah,
trust me, it's pretty fascinating.
it
We're
is.
talking about scrub typhus.
Scrub typhus.
Have you heard of this?
Oh yeah, yeah. I mean, it's not exactly a household name,
Right.
but it's definitely something that, people in certain parts of the world are very familiar with.
Yeah, I mean, it's a bacterial infection
Right.
spread by these tiny little mites called chiggers.
Chiggers, yep.
I mean, have you ever even seen a chigger?
I have actually under a microscope.
Oh, wow, okay.
They're pretty impressive little creatures when you see them up close.
Yeah, I mean, you can barely see them with the naked eye,
No, they're tiny.
but they can pack a punch,
They
right?
can, yeah.
So we're going to really get into, kind of the whole like life cycle of scrub typhus,
Okay.
what it looks like, the symptoms, how you get it,
Yeah.
and why it's so important to catch it
Or
early.
diagnosis, yeah.
It can be pretty serious if you don't.
It can be, yeah.
So one of the things that I thought was really fascinating when we were kind of researching this
Mm-hmm.
is that it can take a while for people to even realize they have scrub typhus.
Yeah, that's one of the kind of tricky things about it. It can be very sneaky.
Sneaky. It's a very good word for it.
Yeah.
When you look at some of our sources, people don't go to the doctor until they've been like running a fever for a week or more.
Yeah, sometimes even longer, like, several weeks, even up to a month. It's pretty remarkable.
A month.
Yeah,
So that's a long time to be feeling bad.
it is.
Why does it take so long?
Well, I think the early symptoms they're just so general,
Yeah.
It's like fever, headache, muscle aches. I mean, that could be anything.
Right. That could be like the flu.
Yeah, exactly. Or just a common cold even. So it's easy for people to kind of dismiss it at first and just think, oh, I'll just, ride this out. It'll go away.
Okay. But at some point it's like, all right, this is not going away.
Yeah, exactly. When the fever just keeps hanging on and you start to develop some other more unusual symptoms, that's when people start to get concerned.
Okay. So what are we looking for here?
Mm-hmm.
What are some of the clues that might tell us, hey, this might be scrub typhus and not just, a bad cold or something?
Right. Well, there is one pretty distinctive sign.
Okay.
It's called a tache noire.
Pashtoir.
Yeah, it's a French term.
Okay.
Basically, it means black spot. And it's this painless black lesion that forms at the site of the chigger bite.
So this is where that little tiny mite
Yeah.
bit you,
Right?
and you get this like black spot.
It's like a black, it's like a black sore almost. It's called an eschar medically, and it often has a red halo around it, so it kind of looks like a little bullseye.
Oh, wow. Okay.
So if you see that, that's a pretty good indication that you might have scrub typhus.
So that's kind of like the smoking gun, the telltale sign.
It is, yeah. In medical terms, we call it pathognomonic, which means it's a very specific sign for this particular disease.
Okay. Pathognomonic. I'm going to remember that word.
Yeah,
But you said it doesn't always happen.
right. Unfortunately, not everyone develops the tache noire.
Okay. So you can't just rely on that.
No, you can't. You have to look at the whole picture, all the symptoms together.
Right. So what else are we looking for? You mentioned a rash earlier.
Yeah, so about 40% of people with scrub typhus develop a rash.
Okay.
It usually starts on the torso and then spreads outward.
Okay.
But there's another symptom that can be pretty surprising,
Okay.
and that's hearing loss.
Hearing loss.
Yeah.
That's not what I was expecting.
No, it's not something you'd necessarily associate with, a mite bite or a fever,
Right.
but it can happen.
So how does that work? How does this
Mm.
bacteria, how does it affect your hearing?
Well, we don't know all the details yet,
Okay.
but we think that the bacteria can cause inflammation
Okay.
in different parts of the body, including the nerves and the blood vessels in the ear.
Okay.
And that inflammation can disrupt the delicate mechanisms of hearing.
So it's not like the bacteria is like directly attacking your eardrum or something.
Right. It's more of an indirect effect through the inflammation.
Okay.
But it can be, it can be quite significant.
Wow. So, I mean, this little mite, this tiny little
Yeah.
creature
Yeah.
can really have a big impact on your body.
It can, yeah. It can affect multiple organs.
Right. And we're looking at the sources.
Mm-hmm.
And, it talked about some pretty serious complications.
Yeah, it can definitely get serious if it's not treated.
Things like pneumonia, inflammation of the brain, meningitis,
Yeah, encephalitis. We can also see kidney failure,
kidney failure, heart problem.
heart problems, and even something called septic shock,
Big shock, yeah.
which is basically a a life-threatening reaction to the infection.
Right. So this is where your body is just like totally overwhelmed by the bacteria.
Exactly. Your immune system kind of overreacts.
Okay.
And it triggers this cascade of events that can lead to, dangerously low blood pressure, organ failure, the whole 9 yards.
So it's not just the bacteria itself, it's your body's response to the bacteria.
Right. It's a combination of both.
Okay.
But yeah, those neurological complications, those are particularly worrisome.
Yeah.
Confusion, seizures, coma, those are really serious stuff.
Yeah, those are all signs that, something's really wrong.
Yeah, absolutely.
And then you look at the mortality rates.
Mm-hmm.
And, I mean, they vary, right?
They do, yeah. It depends on a lot of factors.
And that, like one of our sources said, it could be anywhere from 1% to 60%.
Yeah, that's a pretty wide range.
That's a huge range.
It is.
I mean, that's a big difference.
It is.
So what accounts for that?
Well, a lot of it has to do with where you are in the world.
Okay.
Different regions have different strains of the bacteria.
Okay.
Some strains are more virulent than others.
So some are just nastier than others?
Exactly. And access to healthcare plays a role, too.
Right.
If you're in a remote area and you can't get to a doctor quickly, your chances of survival go down.
Makes sense.
But the good news is, if it's caught early, scrub typhus is very treatable.
Okay, that is good news.
Yeah.
So what's the treatment?
It's a simple antibiotic called doxycycline.
Doxycycline.
Okay. You might be familiar with that one. It's used for a lot of tick-borne illnesses.
Oh, right.
Yeah. And the great thing is, the symptoms usually improve dramatically within, a day or two of starting treatment.
Wow. Okay.
So early diagnosis is really key.
Yeah, it sounds like it.
If you've been in an area where chiggers are common and you're experiencing any of these symptoms,
Okay.
especially a persistent fever,
Don't wait. See a doctor.
yeah, don't mess around with this one.
No?
Get it checked out.
Absolutely.
So knowing all this, I mean, it really does make you think, how can we raise awareness?
Yeah, that's a big question.
Especially in those parts of the world where it's more common.
Right.
How can we make sure people know what to look for?
Yeah.
And how to get treated quickly?
Yeah, I mean, early intervention can make all the difference.
It can. So that's something to think about.
Yeah.
As we wrap things up here.
Definitely.
It's treatable, but we got to catch it early.
We do.
All right. Well, that's our deep dive into scrub typhus.
That was a good one.
I hope you learned something. And stay tuned for our next episode.
See you next time.